Here, paper bag. So we will grab it like this and we'll peel off the paper bag, and then we will bend this blister so that whenever you put this anywhere, it is not in contact with the ground. I can take this out without touching any other surface. Clear? This is the first step. Shah se sanitizer ho gaya? Recommend do. You should use the gloves, whatever you want, nitrile, non-nitrile, powdered one, whatever you want to be, you feel fine with, right? Because that powder actually cause infection or like a lot of itching. So I won't able to do much. So I use the sanitizer only. I just use it multiple times on my hands to make it sterile, right? So these are the first conditions. So we need a model for the guide, a guide tube. These are the three things we are having. Everyone is able to see? So, the first rule of dry needling, always make sure you put the depression with the guide tube. Are you able to see? First rule, that you have to put a depression. Clear? The second thing, you will grab the tube, take off this blue color stopper. Now you are able to see the needle is bit outside.
Yes.
Now we are going to tap, and there is a depression also.
Yes.
Now I'm going to tap this. You will see the needle is pricked into the skin. It is not into the muscle, it is only into the skin. Here is the trigger. What is the most probable site to find a trigger point?
Belly of
Where you can find the trigger point very easily.
muscle town band.
Yes?
Muscle town band.
Muscle belly.
Belly of the knowledge.
Belly of the muscle. So check for brachioradialis for the person standing next to you. Muscle which is following in the structure, will I follow in the same, or I have to follow perpendicular up here? So I will go into the belly and look for a taut band and a jump sign. So as this is the trigger which is latent, it will not show you a jump sign, but is it hyperitable? This is a trigger point. This is the belly of the brachioradialis muscle. Always of the needle, but it has a one more process which is known as fishing. Fishing means, like, what is fishing? When a person throws a rope into the water and tries to catch the fish, he don't only put that wire in one direction, but he changes that direction for finding a fish. Similar, we will move the needle in different direction to find the trigger point. This is known as fishing of trigger point by to and fro method. Method is known as to and fro. To and fro will be done in muscle, trigger, tendon, bursa. To and fro will be done in trigger, tendon, ligament, bursa. So written: muscle, trigger, tendon, ligament, bursa. These are the 4 to 5 structures where we use to and fro method. Clear? So the method, we grab the needle head and move it in a multiple direction. Clear? This is known as to and fro. Any doubt with this? Now the second thing is twirling. For twirling, there are a lot of methods. I have seen few people use one needle and move it in a one direction. The first method, we will take the needle and move this in one direction, but it won't make any difference. For fascia, there are specific needles. We have coarse needles. The needles which you are using is properly polished, but fascia is a very slippery structure. It has water in it, has a hyaluronic acid in it. So hitting that, we have to use 2 needles. One is here, here is second on the base. You can see the second needle is also on the base of the first needle, or maybe very nearby. Right? So the needle is inserted, 2 needles simultaneously. Now what I will do? Rotate them. I will rotate them and make sure it gets stuck into the fascia. And when you heard the sound, means your needle is stuck. What I will do? See, it is not coming out. This is known as twirling. One needle came out. We'll go with the second. So this is known as twirling. This is done for fascia. Thoracolumbar fascia, plantar fascia, IT band and tensor fascia latae. The four structures: tensor fascia latae, thoracolumbar fascia, plantar fascia and IT band. These are the four structures where fascia is very superficial. Clear? Any doubt regarding the second technique? Yes or no? Now the third technique, that is periosteal pecking. Periosteum means bone hit. Yes sir, have you felt this at a bone? So periosteal pecking, we have to make a direct hit over the bone. But where on the bone? Where the bony overgrowths are present? Spur and stress fracture. Bone spur and stress fracture. These are the two surfaces where you will use periosteal pecking. Like your calcaneum spur. People think or students think we are breaking the bone. No. We are not breaking the bone, but we are releasing the soft tissue which is injured by the bone spur. Clear?
Yes.
Any doubt with these three techniques? Yes or no? Sir, Shah sir, break hai abhi? Okay, so people say, sir, if this is stimulating the delta fiber, why we are using this? Sometimes triggers are very deep and we are not able to find them. Because you know, in India there are very strict rules for ultrasound, diagnostic ultrasound. If you are a radiologist, then only you can buy a ultrasound. Otherwise, there is no chance. So for physios, how there will be a chance that you will buy a ultrasound? I have seen a lot of devices in Dubai. People like with diagnostic ultrasound, like this much of a device, like your phone. It has a probe head. When you move that, you have an iPad screen and you will get the structure. But that is not allowed in India. They will capture you on the customs. So like if we get that device, that is very good. If we are not getting, we have to use this to make sure we make the injury, or we stimulate the trigger point which we are not able to approach, because muscle is very diverse. You cannot go very precise until you have a very good palpatory skills. So for this, it's an electronic pen using a 2 volt current. For this, we have to make sure we make a closed circuit. See, is it working, sir? Nothing will happen. Now, you can see the muscle started flickering.
Yes.
The maneuver has to be done 5 to 10 times. The maneuver has to be done 10 times. Either it is your twirling, either it is your bone prick. Now the stimulation also be done for 10 seconds. Clear? It is also be done for 10 seconds. After 2-minute interval. After 2 minutes interval. So total it will be, you have to perform 3 times. Total is 6 minutes. 6 minutes is your actual time for Dryneedling. A lot of people say, sir, I have seen people keep it for half an hour. You can keep this for next 365 days also. But what is the benefit? Whatever the functioning stimulation, wherever you are giving per needle, 10 seconds. When you are not able to find the trigger, then only. If the trigger is very deep, you are not approaching that, then use the pen. Otherwise, it is fine. And either it is look fancy also. If you are doing this on your patient, it helps you, but it looks fancy also. Yeah, you can see the middle fiber and the posterior fiber.
So it may stimulate 2 trigger points.
Yes, like more than 2 also. No, not a problem. Not only the trigger. This is a continuous current.
Oh.
But for those people, we need specific type of current. Few people prefer Faraday.
Why?
Few
Because
people
I've
prefer
seen
galvanic.
I've seen few people using the same in Faraday.
Yes. That is for paralytic only, which I told you.
This is for only for pain management.
Orthopedic. Yes. Orthopedic and sports condition for pain management.
Okay.
Not for
See, if you have
Neuro
seen
condition.
quacks, if you have seen reviews of quack treatment, few people you will get, oh, I went to that quack, he gave the result within one session. Few people you will get, I went to that guy, he broke my back more than before. So what is the thing that they follow? They give same impact for everyone. Quacks. They won't have any particular technique. They do same thing for everyone. For on the person if I have seen one. There is a quack. What he used to do, he used agarbatti, maybe you know, incense stick. He burned that incense stick, make it a little red hot, and burn the motor points. I sent my friend's father to him, and they got the result within 2 sessions. Like first session, their face was very fine, and second session, they are able to blow the whole balloon, not a small one, bigger one. They blew the whole balloon in a second session. I was also very horrified. How it did? He's not even a therapist, he's a quack, but his son is a physiotherapist. So like they are people are actually doing. They have one thing which is very common with every quack. They are metal, they make it red hot and perform it on special structures. Like they have their own acupressure something, which they used to call marma points or something. Like acupressure points, they used to burn the points. I also tried it on my anterior shoulder and it gives very good result. Actually. So things are there which exist if they are aware of. Okay, go fast. Let us have a look at it.
So कहीं पे भी अभी now we are
Just suppose we are doing on brachioradial, don't go much. Here is the fiber, palpation, perpendicular. मिल गया सर trigger?
पीछे आ गया सर हाँ देखिए आ गया
अगर बाई चांस स्विच नहीं आ रहा, ट्रिगर बहुत डीप है, तो क्या करेंगे? Yes, sir. Radialis. Yes, sir.
Hold it. పట్టుకో అట్లా తీయకు ఏం చెప్పాడైనా ఇట్లా పట్టుకోవాలి పేపర్ తీసేసుకుని ఇది ఇట్లా అన్నంటే పక్కకు పెట్టుకో ఎందుకంటే ఎట్ ఏ టైం మనం 2 నీడిల్స్ పట్టుకోలేదు పక్కకు పెడితే కింద తగులుతుంది డిస్ఇన్ఫెక్షన్ ఉండదు మనకు నేను సైడ్కి సెట్టింగ్లో చేయొచ్చు సైడ్ లైన్లో చేసి
There is no chance of breaking the if we do this way.
Yes. ఈ పైన హెడ్ ఉంది చూసావా? అక్కడి వరకు వెళ్ళచ్చు ఆ రఫ్ సర్ఫేస్ వరకు మనం వెళ్ళాము
Sir, periosteal.
We went into the tendon. Means 50 mm can go in this direction very easily. Clear? Any doubt with this?
అంటే కంటిన్యూ ఒక దాని ఒక తర్వాత वैसा नहीं सर, शर्म की बात नहीं, ये पतला है, ये नीडल्स डाले तो नहीं होता हमारे
ట్యూబ్ బ్రష్
పైకి లాగు పైకి లాగు
పైకి లాగదా వదిలే కొట్టు ఇప్పుడు
ఇంకోసారి కొట్టు
ఏం సిక్స్ మినిట్స్ లాంగ్ ఉంచవచ్చు మనం టూ అండ్ ఫ్రో కానీ స్ట్రిల్లింగ్ అది చేసుకోవాలనుకుంటే ఎవ్రీ 2 మినిట్స్కి
షార్ట్
It won't remain constant, right? Sitting position. So the next condition that we have is golfer's elbow. Which muscle is responsible for golfer's elbow?
కామన్ ఫ్లెక్సర్ వచ్చి
Origin is there, but which specific muscle I will categorize as primary, secondary, or tertiary? Ulnaris is primary. Which one is secondary? Palmaris longus, carpi, radialis. These are the three muscles which are majorly being used, or you can say affected in the golfer's elbow, right? So, first of all, you were not able to see, you should come to this side, make a bigger space. Yeah, move.
ఫ్లెక్సర్ వచ్చి
Common flexor origin. So now, finding the muscle, like if I say, bend these two fingers, like pressure, these two only. Are you able to see any muscle? Properly, if I say, no? Yeah, 3 fingers. You are not able to see. Here it is a problem. Because flexor compartment is more over tighter and overlapper. See. Flexor muscles are like this. So you are not able to see any particular muscle. For this we have a mnemonic. I will put this region, this particular area on common flexor origin. You can see. Now 3 fingers. Flexor carpi, palmaris, third is radialis. These are the 3 muscles which are responsible. See, flexor carpi, palmaris, flexor carpi. These are the 3 muscles which are majorly being affected. And the tendon also. Tendon also gets affected. The common flexor tendon. Simple, it's not a big deal. So we
1,
use
2, 5.
the small end. What should be the angle according to you?
90 only.
90-degree directly into the trigger. Fine. Easy. We have the space. Not a problem. Then
45
give me one electropin. The thumb side we have the flexor carpi. Now we are going for the central one. Now you are able to see the palm. He is able to contract the flex the palm. It is low. Are you able to see the palm? Now I think palm is not visible. Just for 2 strokes I'm doing, making it 3. Have you seen? The palm is getting flexed. You can see the radial side. Alnaris? Done? So this will...
one
रोज पढ़ाना, रोज कॉलेज ओपीडी में करना, मेरे लिए तो कॉमन है। मेरे को पढ़ाने में इतनी प्रॉब्लम नहीं आती। मेरे को कंडीशन, जैसे कंडीशन बता दी, मसल्स बता दी, इसको डीलोड कर देंगे, बात खत्म। कितना प्रॉब्लम है?
చెక్ చేస్తాను మొత్తం.
That's all.
पेशेंट का
पेन तो వస్తుంది కదా. ఈ పెయిన్ ఫీల్ అవ్వదు. పేషెంట్ అక్కడ
ఫస్ట్ అవి తీసేసి
right, you can see the whole nucleus. I'll show you the static also. Sir,
ఓన్లీ 1 జీరోలోనే సూపర్. నేను ఇన్స్పైర్ తీసేస్తున్నా
విజిట్స్
యూస్ కాటన్.
आप काटन